Next up, for the retina side of things, we have Dr. Diva Kant Misra, who will be providing a diabetic eye care guide for patients. Let's watch the video.
Hey, Diva Kant, welcome to Mice TV. Thanks for joining us.
Thank you so much, Matt, and so happy and excited to be here.
Well, you know, Diva Kant, I've just read an article featuring you in the Times of India. Congratulations.
Thank you so much.
So according to that article, 74 million people have diabetes, I saw, and 39 million people live with undiagnosed diabetes. This is, of course, all in India. You know, this accounts for about 8% of the Indian population. It's always been reported in literature that diabetes is an epidemic in India. In your clinical practice, what percentage of your patients are diabetics, would you say?
I would like to say that it's a global epidemic as of now. If you look at the data by the International Diabetic Federation, there were 460 million diabetics in 2019, which is supposed and expected to rise up to 700 million by 2045. Unfortunately, India is the diabetic capital. On a busy day, almost maybe up to 30 to 40% of my patients are diabetics.
Is that because of the dietary issue, essentially? I mean, every time I come to India, I'm always eating gulab jamun, for example, but is there this Indian fascination with sweets, or what is really the cause?
We are genetically predisposed to diabetics. So we have a strong genetic predisposition to that. The high insulin resistance that is seen in Indian, there's a lot of central obesity, visceral fat, and all of these things lead to insulin resistance and higher incidence of diabetes. And in various studies, we have also seen that the physical activity is, especially in the urban Indians, is supposed to be low. With the dietary modifications, the Western diet coming into the Indian diets, so it's all high calorie, high fat, high sugar. So all of these things lead to diabetes.
Well, can you elaborate on what are some of the most common conditions that diabetic patients coming to your clinic suffer from in terms of the eye?
Diabetes affects multiple organs in the body, most of the parts of the eye. Top three things, that is cataracts, affect the retina and lead to diabetic retinopathy, and it can also lead to a form of glaucoma that we call as the neovascular glaucoma.
How can diabetic retinopathy, as you mentioned, be caught early in these patients?
We have to have that understanding that the effect of diabetes on the eye can be devastating. People can go blind so easily if the disease goes unchecked. Once you know that you have diabetes, you have to get your eyes screened on a regular basis. If a type 1 diabetic patient is there, he should get eyes checked within the first 5 years of being diagnosed, and a type 2 should get it done as soon as possible. And if you're found not to have diabetic retinopathy, then you need to do it on an annual basis at least. And if you are a diabetic, then it has to be, of course, more frequently depending on the condition of the eye. There are various tools that we have that affect us, that aid us in screening and diagnosing these diseases. One is the clinical examination through 90 diopter lenses, where on a slit lamp, we can clinically diagnose the patient. And there are certain instruments, certain machines that help us. We can document the photograph of the retina. Now, artificial intelligence is coming in a big way in diagnosing through these photographs and scans. And without even a trained physician or a trained doctor, the AI will in the future help us to diagnose through simple scans. Another is the OCT scan, optical coherence tomography, where we can look at early edema that can be caused due to diabetes. Then angiography can be done, OCT angiography can be done. All these things help in catching the disease early.
Well, you've talked about prevention, but when it comes to diabetic retinopathy treatment and management, what are the modern possibilities?
So prevention is the number one thing, as we have discussed in the previous question. But when you have that disease and you have the various symptoms and signs of that disease, then we have a lot of options on the table. Number one, of course, is a good glycemic control. If we spot some early changes of diabetes, then we have to ensure that a good glycemic control has to be there. Not just glycemic control, there are various other factors that need to be controlled, like the hemoglobin of the patient, the blood pressure of the patient, the lipid profile, the kidney profile, vitamin D, and the overall health of the patient has to be monitored and controlled well. So that will prevent the disease from progressing. and that will also at times it helps us in reversing the process of diabetic retinopathy. But once the disease starts and we have to give some treatment, there are largely three types of treatment that we have: the anti-VEGF injections or steroid injections. Whenever we see a lot of neovascularization or a lot of edema, then we need to inject the patient with these drugs. Then the number two thing that we have are the lasers. Now the role of lasers is diminishing over the period, but it definitely has role in proliferative form of the disease, where we can further prevent the proliferation of diabetic retinopathy, and at times we do it to reduce the edema in the eye as well. Number three is the surgery. Now when we see that there is a lot of traction on the retina, or we have proliferative kind of a disease with vitreous hemorrhage, tractional retinal detachment, then we definitely need to go in for surgery. So vitrectomy surgery coupled with injections, ILM peeling, at times we have to inject oil or gas to settle the retina. These are the options that we have to treat the disease.
Well, I understand that the diabetes rate in India is still lower than in some countries. Like, for example, in the US, it's 11.3% compared to that 8% in India. But of course, India's got this massive 1.4 billion population. So, the pressure from this huge number of diabetic patients that can develop eye conditions could certainly burden the whole eye care system. How are eye doctors working together to address this issue?
The number one thing that we focus on, as we discussed earlier, is the awareness and screening. So in my center also, and the previous places where I've worked, and all of our colleagues are some or the other way involved in screening these patients. So we hold what we call as diabetic screening camps on a very regular basis. At least once in a month I do it in my center, and similarly all of my colleagues, and usually these are free of cost. What we are trying, a lot of the technologies have come in where we don't need to dilate the eyes to examine them, right? So that is a big hindrance when we see a lot of working professionals. They don't want to get dilated and get their eyes checked, because for the next 3, 4 or 5 hours probably you'll have blurry visions. So the newer technologies that we have, they can diagnose the disease without even proper dilation of the eyes. So that is helping us a lot.
I know the Young Ophthalmologist Society of India, or YOSI, is a very dynamic group. And of course, you're the secretary at the moment. How is that society addressing this problem in India?
Just one quick update. So recently we had elections, and now I'm the vice president of the society.
Congratulations.
Yes, this has been for us an important issue. Our parent body, the All India Ophthalmic Society, had in the last few years before the COVID, they had organized and had given funds for diabetic screening camps. So that is something that we are also working on. A lot of young practitioners, people who are into practice, may not have funds to organize these camps or take the burden of that in the early phase. So we are trying to help them out in terms of technical guidance, and hopefully with some funds as well in the future.
It certainly all comes down to education. So how can doctors raise awareness for the population about having a regular eye checkup if you have diabetes?
So I think number one thing would be platforms like Mice TV here, which will definitely help in getting the word out. You can get on a YouTube channel, get on your Twitter, Facebook. There are a lot of people who are connected, our closed ones, our friends of friends, right? So we need to have this message about at least the important diseases like diabetes, retinopathy of prematurity, diseases that can be prevented from progressing by intervention, by some other modifiable risk factors. So the message should be out, and we all should utilize the power of social media, take help from people like you to get the message into the society about these diseases.
It strikes me that, over the time that I've been covering Indian ophthalmology, the country was certainly working to eradicate the cataract backlog. But you being part of this young society in India, it makes me wonder whether the future is, not only cataract, but these retinal diseases. Is this sort of the new frontier of the so-called disease backlog?
So cataract used to be, and probably is still, the number one cause of diabetes, apart from things like refractive error and others. We have done great work in terms of cataracts. the focus is slowly shifting onto other things like glaucoma and retinal diseases. And amongst the retinal diseases, number two things that are very important, as I mentioned, one is diabetic retinopathy and the other is retinopathy of prematurity. So awareness is slowly increasing about these diseases. A lot of government initiatives are coming. Another thing is that the number of retinal experts is going up. A lot of people are getting trained, and now people are taking responsibility and creating awareness, putting pressure on the government. So a lot of work has been happening, and hopefully within the couple of years we'll have some great projects and great screening projects for this disease.
Well, Diva Kant, thanks for joining hands with us here at the launch of Mice TV, raising awareness not only in India but around the world about important eye conditions. You've been a great guest. Thanks for joining us here.
Thank you so much, Matt. And as we said, that the awareness is very important, and I'm sure that this new Media Mice TV will help us in doing that. And look forward to further collaborations on a greater scale.